Hi, hello everyone. Welcome to Forensic Medicine Farre Series. Yes, good evening, Jojo. Yes, okay. So, good evening, everyone. So, we're discussing some important long essays, short essays, and some important short answers in mechanical injuries. Yes, am I audible and visible properly? Am I audible and visible? So, mechanical injuries. Mechanical injuries, some important topics are like abrasion. So, types of abrasion and medico legal importance, types of contusion, medico legal importance, laceration, stab wound, incised wound, firearm injuries. So, the question can be asked from thermal death, antemortem burn, postmortem findings in case of burn injuries. So, and one very important topic is grievous hurt. The grievous hurt is very commonly asked question in your exam. Yes. So let's see. Let's start. Describe grievous hurt. So the question is describe grievous hurt as per 320 IPC or as per BNS Bharatiya Nyaya Samhita. What are the clauses of grievous hurt and with examples? One very commonly asked in your theory exam, practical exam, and also in Viva. Grievous hurt. Okay? Yes. So in exam, you need to write. So grievous hurt defined under section 320 IPC. So grievous hurt defined under section 320 IPC. The grievous hurt is punishable under 325 IPC. So as you know, IPC Indian Penal Code now it is outdated. It is replaced by BNS. So that is 116 BNS. So 320 IPC is equal to 116 BNS. What is BNS? Bharatiya Nyaya Samhita. Okay, fine. So a grievous hurt has 8 clauses. How many clauses? There are 8 clauses are there. So this can be MCQ. Number of clauses in grievous hurt. There are 8. Okay, what is grievous hurt? That is a legal definition of grievous hurt that comes under 320 IPC or 116 BNS. Yes. So what is the clause number 1? The clause number 1 is emasculation. Emasculation. So anybody, what do you mean by emasculation? Anyone in the live lecture can answer what you mean by emasculation? Is it applicable to male or female or it is applicable to both? Emasculation. Yes, anyone? So emasculation, that is applicable only to males. Okay, applicable only to males. What do you mean by emasculation? It is the loss of masculine vigor or masculine power in a male. Okay, or because of the injury emasculation, he is unable to do sexual intercourse. Like example, damage to genital organ like penis, amputation of penis, injury to the testicles, or injury to the lumbar sacral vertebra, lumbar vertebra. So lumbar vertebra and lumbar flexus that carries you know impulses from sympathetic and parasympathetic system. As you know, erection is because of parasympathetic system, ejaculation that is because of sympathetic. So when there is a damage to lumbar vertebra, so because of trauma or because of the assault, when person is going to become impotent, so that is can be emasculation. Okay, so emasculation example, so the fracture of lumbar vertebra, okay, or damage to genitals, that is emasculation. So and this is punishable under 325 IPC. Okay, yes, so that is about the clause number 1. So emasculation is a terminology, is a clause applicable only to male. It is a loss of masculine power in a male, either due to damage to genitals or due to lumbar vertebra. So that is 1. 2, that is permanent privation of sight of either eye. So as you know, there are two eyes, right? Permanent privation. It's permanent, not temporary. This word is important. So in exam, you need to write the same word. It's a permanent phenomenon. Privation means loss. So permanent privation of sight of either eye. And remember, it is not related to surgical intervention. It is not related to surgical intervention. It is the natural course of the disease, natural course of the trauma. So complication is known as, that is permanent privation of sight of either eye. Like example, corneal tear, gouging out of eyes. So there can be permanent loss of vision, right? That is the clause number 2. What is that point number 2? Yes, Jojo. Point number 2. Yes. Then clause number 3, permanent privation of hearing of either ear. Like example, tympanic membrane perforation. So when there is a tympanic membrane perforation, there can be conductive deafness. It can be complete, or it can be partial. So it is not associated with any surgical intervention. Okay, it is all due to the natural course. Sometimes what happens even after grievous hurt, so it can be treated by tympanoplasty or corneoplasty, but still it is a grievous hurt as per 116 BNS. Whether it is treatable, not treatable, that is not included in 320 or 116 BNS. It is a natural course. What would be the complication? Like example, corneal tear, that definitely causes permanent loss of vision. It can be grievous hurt. Tympanic member perforation, like example, slapping over the ear, that can lead to permanent deafness. That is a grievous hurt. Yes, permanent privation. Permanent privation means loss, beta. So Jojo, privation means it is the loss. Privation means loss. So the clause number 1, emasculation. Clause number 2, permanent privation of sight of either eye. Permanent privation of hearing of either ear. So you need to write the same word in the exam. Don't change the word. Okay. Then privation of any member or joint. Any member or joint. Here the question can be asked, what do you mean by member? Member is a part of the body which has specific function, which has some distinct function. So can I name one member, an example? Anybody? Anybody in the class? Can you give one good example for member which has a distinct function? So like example, fingers. Okay, finger is a member of the body. It has a distinct function. Hand is a member. Foot is a member. Limb is a member. So when there is amputation of finger, amputation of the limb can be a grievous hurt. Okay, so this can be asked in your exam. What do you mean by member? What do you mean by member? Yes. Next, look at this. 4 images are there here. So 4 images. Can you identify what are the 4 images here? So this is the clause number 1 we discussed. The clause number 1 is damage to genitals or the testicles, lumbar vertebra. So this is the clause number 2 we discussed. Gouging out of eye, corneal tear can be grievous hurt. So clause number 3 we discussed tympanic membrane. So this is the tympanic membrane perforation, TM perforation. So this is the member. You can see the amputation. Amputation. So amputation of the thumb can be grievous hurt. So have understood the first 4 classes, guys? Yes. Have understood the first 4 clauses? So there are 8 clauses are there. There are 8 clauses are there. Say yes or no? Yes. The 5th clause, destruction or permanent impairing of power of any member or joint. So destruction, like example, joint destruction because of road traffic accident, or knee joint dislocation because of the assault, road traffic accident. Destruction or permanent impairing of power of any member or joint. So one good example you need to write like this: bone contracture. Bone contracture. See, when there is a bone contracture, especially in upper limb or lower limb, so especially in upper limb, so there can be impairment of power of the upper limb. Or when there is a wrist drop, foot drop, because of damage to the nerve, the limb may look normal, but there will be impairment of the function. So that is about the 5th clause, that is the power. Okay, you can remember 5th clause, power star, like that. 6th one, the 6th clause, permanent disfiguration of head or face. Permanent disfiguration of head or face, either due to burn injury or due to acid attack. Okay, so now it is acid attack, it is included in 124 BNS. Okay, so vitriolage, that comes under, vitriolage means acid attack, so that comes under 124 BNS. So there is a separate BNS for acid attack, that is 124. So other than acid attack, any injury which causes permanent disfiguration of head or face, that can be grievous hurt. 6th, you can remember 6th sense, that is your head and face. Yes, I'll let you know Nirmal Malhotra about this. So 6th over. 7th one. 7th, remember, it is related to fracture. Any fracture, like example, metacarpal fracture, skull fracture, any fracture in the body. are dislocation of bone, dislocation of joint, shoulder dislocation, elbow dislocation, knee dislocation. Any dislocation can be grievous hurt. Or tooth dislocation can be grievous hurt. Okay, so it should be fresh injury. Fresh injury, there should be hematoma, and because of that injury, road traffic accident or assault, if injury is fresh and there is a dislocation, then it is grievous hurt. Yes. Namaskar, Pratik K. Namaskar. And the last clause, very, very important clause, guys. This is very commonly asked in Viva. We do ask this question to every student in Viva exam. What is the 8th clause of grievous hurt? What is the 8th clause of 116 BNS? 320 IPC? We do ask. Your answer should be, sir, 8th clause has 3 sub-clauses. What are 3 sub-clauses? Any hurt which endangers life. Any hurt which endangers life. The next question comes, what is the example for that? Can I name one injury which endangers life? In some books it is written it is a dangerous injury. Anybody? Can I name one injury which endangers life? Pratik and Jojo and others. Come on, guys, come on. Endanger. Head injury can be endangers life. Hematoma, endangers life. Stab injury over the abdomen. The good answer is stab injury. Stab injury. Any stab injury can be grievous hurt. Any stab injury. Stab injury over the neck, stab injury over the thoracic cavity, abdominal cavity. Definitely it is a grievous hurt. Okay, stab injury. Surgical negligence. Surgical negligence, because this grievous hurt and all, basically it is to define assault and the injury and all, so not related to surgical negligence. So medical negligence, surgical negligence, that has a different entity. We have other BNS and IPCs for that. So this grievous hurt basically to define the trauma and the injury, assault and the injury and all, just to punish. So in simple injury, punishment is 1 year of imprisonment. So if it is grievous hurt, the punishment increases up to 7 years. So the judge is going to decide the injury and also the punishment depending upon your report. So if you give grievous hurt, the quantum of punishment differs. If you give report simple injury, the quantum of punishment is 1 year. So you are helping the judiciary, you are helping the judges, magistrate, just to get conclusion of the injury. Okay. Yes, fine, Pratik, fine. Okay. Does the bodily hurt includes mental aspect? No, better. So here grievous hurt basically it is the physical injury, not the mental hurt. Okay, so yes. Then which causes sufferer to be during the space of 20 days severe bodily pain. So now it is 15 days. Okay, so previously it was 20, now it is 15 days. So according to IPC it is 20, according to BNS it is 15 days. Severe bodily pain, the person is unable to do ordinary pursuit for 15 days, can be grievous hurt. Ordinary pursuit, like example, having food, going to toilet, combing, buttoning, unbuttoning shirt, all these are routine activities. So when person is unable to do his routine activities like having food, walking and all, then it is a grievous hurt. It is not the professional work. It is not about the professional work, like example car driving, typing or something like that. It is all routine day-to-day activities. You need to observe the patient for about 15 days. Then only you can give the report. Yes. Fine. So this is about the grievous hurt. Okay, there are 8 clauses we discussed. The 5th one is about the destruction, permanent impairing of power of any member or joint. permanent disfiguration of head or face, fracture dislocation. Lastly, the eighth clause, which has three subclauses. So, subclause number one endangers life, severe bodily pain. The person is unable to do ordinary pursuit for about 15 days. Yes. Now look at this, guys. So there are four pictures. So there are four pictures showing grievous hurt. So the picture number one, so this is a bone contracture. Bone contracture. So this is the clause number 5. Disfiguration of face, not due to the acid attack, maybe any injury, that is clause number 6. Fracture dislocation, that is the clause number 7. The clause 8, the person is unable to do ordinary pursuit for about 15 days, can be grievous hurt. So this is how you should answer the question in your exam. So have I understood, everybody? Grievous hurt. Yes, Jojo, have understood? So this is about the grievous hurt. So when the question asked in your exam, though, this is how you need to write. Okay. Yeah. Now you need to answer. So there is a funny question, guys. So Gabbar Singh causes scratch abrasion of Amitabh's cornea, leading to permanent scar, results in partial vision loss. So there is a partial vision loss because of assault. The accused offered for corneal transplantation at his expenses. Now the victim is able to see very clearly. True about above scenario. He is not guilty as he agreed to pay expenses of corneal transplantation. Not guilty because vision loss is temporary and partial. Is guilty of hurt, guilty of grievous hurt as per 116 BNS. So what would be the best answer, guys? So this scenario, guys, not guilty because he agreed to pay expenses. No. So there is no monetary settlement. It's a grievous hurt. So it's a criminal offense. Vision loss, corneal tear, corneal abrasion can be grievous hurt. It is not a simple hurt or hurt, it is a grievous hurt. So the answer is, he is guilty of grievous hurt as per 116 BNS. 116 BNS. Next question. Define abrasion and its types and medico-legal importance. One very frequently asked question. Define abrasion. See, abrasion is the most common mechanical injury. So if you see abrasion, bruise, contusion, incised wound, stab wound, abrasion is the most common mechanical injury in road traffic accident. What are the types and medico-legal importance? So it's a short essay type, 5 marks question. You need to define abrasion. What is abrasion? Abrasion is a superficial injury affecting superficial part of the skin. What is that? Epidermis and also part of the dermis, right? So what is abrasion? Removal of superficial layers of skin. What are the layers of the skin? You know, skin, epidermis, reticular dermis, papillary dermis and all. So most of the abrasion, there will be damage to epidermis or some part of papillary dermis. So, but remember, the funda is it can regenerate. Any injury which can regenerate, usually that is abrasion. Abrasion can regenerate. That's why we call it as abrasion, as a simple injury most of the time. Friction against a rough surface. So it is caused by blunt object. So it is caused by blunt object. So in general, so abrasion is caused by blunt object. This is how you should answer. You can also add one more point. It is the most common mechanical injury. Second point you can write, it can regenerate within 7 to 10 days. Most of the time it is a simple injury. It is a simple injury type. So if you write this definition, that is fine. Okay. What are the types? Abrasion in standard textbook, it is classified into 4 types. Again, depending upon the force. If it is a tangential force, when force is applied at an angle, so then it is tangential force or compression force. So either tangential force at an angle or compression force, that is horizontal or vertical compression, that is tangential linear abrasion and graze abrasion. Linear abrasion and graze abrasion. When it is compression force, patterned abrasion, non-patterned abrasion. Pattern abrasion again classified into impact abrasion, pressure abrasion. So broadly it is classified into linear abrasion, graze abrasion, impact abrasion, pressure abrasion. Impact abrasion is also known as imprint abrasion. You will see imprint of the weapon in case of imprint abrasion. So I'll discuss again. Linear abrasion is also known as scratch abrasion. Scratch abrasion. In linear abrasion, there will be scratch like this. There will be multiple scratches like this. So what you can see, significant length is there, but width is very small in scratch abrasion. Width is very small. So graze abrasion is also known as brush burn, also known as gravel rash, which is the most common mechanical injury in a road traffic accident because of the friction between the skin and the weapon causing it. It is also known as brush burn. So graze abrasion, also known as brush burn. It is also known as gravel rash. Gravel rash. Okay. Graze abrasion. Imprint abrasion, impact abrasion. You will see imprint of the weapon. Like example, tire mark. Tire mark in case of road traffic accident is example for imprint abrasion. Pressure abrasion in case of hanging. In case of strangulation. So in hanging we see a ligature mark. A dry, hard parchmentization ligature mark is example for pressure abrasion. I'll repeat again. So abrasions are classified into 4 types. Scratch abrasion, graze abrasion, imprint abrasion and pressure abrasion. So let's see, there are 4 abrasion. So can identify all the 4 types? Anybody? All of you guys identify the 4 abrasion given in the image. So the image number 1, what we can see here, parallel lines. Okay. So this is image number 1. This is image number 2. This is image number 3. This is image number 4. So what is this? Identify. What is image number 1, 2, 3, 4, guys? In image number 2, what we can see here, there is a abrasion like this. This is what the abrasion like this. This is what the abrasion like this. Yes, one is linear abrasion. Very good. So one is linear. No, one is graze abrasion. Very good. So the one is graze abrasion. Very, very good answer. Graze abrasion. Graze abrasion also known as brush burn, gravel rash. because of the friction between the vehicle and the surface, or the vehicle surface and the skin. So there will be a loss of the upper part of the skin, that is known as graze abrasion. So you will see parallel lines, parallel lines. By looking at the parallel lines, you can tell about the direction also. Direction of the force. What is the direction? Right to left or left to right, downwards, upwards, like that. So that is the importance of graze abrasion. So parallel lines. So it is the most common one. Most common abrasion in road traffic accident. So yes, good. Deepika Das answered. So 2 is linear abrasion. Very good. So you can see significant length, insignificant width. Scratch abrasion example. Scratch. Scratch. The image number 3, that is the case of hanging. When the pressure is applied perpendicular to the body for a long time, in case of hanging or strangulation, you will see black or brown color abrasion, oblique, that is pressure abrasion. This is the pressure abrasion. The 4th one, you can see imprint of the weapon causing it. It looks like a tire mark. So it is imprint abrasion. Imprint abrasion. So very good. So imprint a pattern. So pattern can be 2 types, pressure and imprint, guys. Okay. Yes, guys. You have understood the types of abrasion? Deepika Das, Jojo. And remember, most of the abrasion simple injury, except the corneal abrasion. So in most of the time, say graze abrasion, scratch abrasion and all, they usually heal without any scar mark. So they are simple injuries. They are not grievous hurt. Okay. MLI of abrasion. What is medico-legal importance? See, in forensic medicine, any question asked, you need to write MLI, medico-legal significance. What is the medico-legal significance of abrasion, laceration? Even it is not asked, you can write in the answer sheet. Medico-legal importance. Okay. So I said most of the abrasion are simple injuries, except corneal abrasion, which can be grievous hurt. Okay. So the point number 1, it indicates site of impact, direction of force. So it shows direction. It also shows the site of impact. So like example, a case of smothering. Smothering. So in case of smothering, you will see some abrasions around the face, around the mouth and nostril. So when abrasion is there, that shows site of impact. Like example, hanging ligature mark, that shows site of impact, site of injury. Direction of force depending upon the denuded epithelium. Okay, so denuded epithelium, you can tell about the direction, right to left or left to right, or upwards or downwards. That is the importance of abrasion. Okay, so at terminal end you will see denuded epithelium. Terminal end, denuded epithelium. Okay, so when you see denuded epithelium, a group of epithelium at one end, that is the terminal end. So the direction is from the opposite. Okay, yes. Yes, very good, Jojo. Good. Yes, for every question. Good, good, good. So every question you should write medico-legal importance. So what is forensic medicine, guys? Forensic medicine is application of medical knowledge in the field of justice. So you need to help the judiciary system by giving report. You should have medico-legal importance. Like in case of sexual assault, when you see abrasions over the genital area, abrasions over the breast. So that is the importance of abrasion. So site, it shows site of impact. It also shows direction of force. Then second thing, Pattern abrasion, type of weapon is also can be identified. Type of weapon, like tire mark. So you can say tire mark is caused by tire, vehicle probably, two-wheeler or four-wheeler. Looking at the size of the tire mark, sometime you will get important clues about the vehicle as well. So type of weapon can be identified. Age of injury, by looking at the abrasion, looking at the color, you can tell whether it is a fresh injury, 2 to 3 days injury, 1 week injury, or healed injury, old injury, something like that. So say example, it is brown color, so it become brown color in 2 to 3 days. 2 to 3 days. Brown in 2 to 3 days. Reddish brown or brown. Okay. Then carnal abrasion can be grievous hurt. So carnal abrasion can be grievous hurt. So this is about the MLA of abrasion. So when short essay asked in your exam, you need to define abrasion. You need to classify abrasion depending upon the force, types of abrasion depending upon the image, and also you need to write about the MLA of abrasion. So I've understood all of you guys. Shall I move ahead? Yes, guys. Deepika Das and Jojo. Now some image based questions. Now look at this. Identify what type of abrasion is this. What type of abrasion is this? It's a case of road traffic accident. So because of the road traffic accident, because of the friction, so between the surface and the skin, you can see loss of the upper part of the skin. You can see here. So it looks reddish color. What type of abrasion is this, guys? Very good. So this is your graze abrasion. Graze abrasion. Good. Look at this. What type of abrasion is this? A case of sexual assault. You can see there is a clearly visible abrasion there. Is it a human bite or animal bite? So this is the importance of forensic medicine. You know? So or it is a bite that is caused by so a child or an adult. Okay, so imprint. So it is basically imprint abrasion. Imprint abrasion. Imprint of the teeth. So teeth imprint is there. Okay. Okay. Then look at this now image, all of you guys. There is a dead body in the postmortem room. While examining at the bony prominences, I found this abrasion. It looks yellow in color. So yellow at the bony prominence. Yes, guys. So a case of natural death. On examination at the bony prominences, so yellow patch is there. So is it an abrasion or what it is? What it is, guys? So this is actually not an antemortem abrasion. This is the postmortem abrasion or postmortem artifact. So it is not the real abrasion. So it has occurred after death. So because you can see yellow color, so yellowish probably. So because of the transport injury. So while transport of the dead body, there can some injuries would have happened, right? So this is a case of post-mortem artifact. Yes, not an abrasion. Good. Now a case of sudden death. A case of sudden death in a rural area, which is a prevalent area of snakes. The patient is having ptosis, the patient is having respiratory paralysis, the patient is having dysphagia, dysphonia, and all. Yes, guys, this looks like an abrasion, looks like an imprint abrasion. You can see imprint of two two important fang marks. So what is this probably? So this is the use of abrasion. By looking at the abrasion, you can give opinion about the injury. So what is this, guys? The patient is having ptosis, neurotoxicity, neurotoxic snake bite. My question is, what is the probable snake in this? Yes, very good. So this is cobra bite, probably cobra bite. So in cobra bite, you will see neurotoxicity and a fang mark. Yes. One more question for you. So corneal abrasion we discussed already, right? Yes. So next question. What are the features of entry wound? What are the features of entry wound? One very, very important question, guys. Entry wound, exit wound, firearm injury basically. It's a firearm question. So firearm injury nowadays they are very common. Maybe a case of suicide, maybe a case of homicide, accidental death. I know. So what are the features of entry wound? What are the features of exit wound? Differentiate between entry wound and exit wound. Very, very commonly asked question. 5 marks question in your exam. So Baleshwar Thakur. So try to understand. I'm using very simple language, very, very simple English. So okay, try to understand basics only. Don't worry. So what are the features of entry wound? Entry wound. Hmm? Entry wound. Anyone can answer one point about entry wound. What is the finding in entry wound? Anyone in the class? Anyone? Entry wound. Firearm entry wound. Firearm entry wound. Yes, very good. Abrasion collar is there. Small diameter. Good point. Good point. Let's see who all answered. Very, very good, guys. Very, very good. So, example, this is the entry wound. Okay. What is this? This is the entry wound. Entry wound. Okay. So, around the entry wound, what are the findings? What are the findings? So, yes, point number 1, inverted. Very good. Deepika Das answered. Baleshwar Ra. Okay. Yes. So, entry wound has abrasion collar. So, it has abrasion collar. So, when a bullet, when spin over the skin, they spin over the skin like this, they spin. So, it forms abrasion collar like this. So, this is abrasion collar. Abrasion collar. Abrasion collar is a collar seen around the entry wound because of the spinning movement of the bullet over the body. It spins over the body, epidermis, dermis and all. So that forms abrasion collar. The second point, grease collar or dirt collar, also known as bullet wipe. The bullet, there will be lubricant around the bullet. There can be some dust around the bullet. So that is also present around the entry wound, like this. So grease collar, like this, grease. So this is the grease collar. Green color is grease collar. That is the bullet dirt. So along with the bullet, there can be lubricant, along with the dust particle. So all this comes around the entry wound. That is known as grease collar, dirt collar, also known as bullet wipe. So this is the second point. Third point, inverted, you said. Yes, very good. Small in size, inverted, very good answer. But the point I require, blackening. So around the entry wound, you will see like this. You will see blackening. because of the soot particle. Like this, you will see blackening. So this is known as blackening. So blackening because of what? Soot particles. Gunpowder, there is a combustion of gunpowder. When there is a combustion of gunpowder, there can be formation of the soot particle. The soot particle that forms the blackening. Viva question. So blackening is caused by soot particle. That should be your answer. Smudging is also same. Smudging, soiling, smoke, soot, all is the same word that is given to blackening. Okay? Yes. Now, in some entry wound, especially in case of near shot, you will see tattooing. You will see tattooing. So what are tattooing? The tattooing are superficial injuries. So they are superficial injuries. Injuries because of the gunpowder. So gunpowder also penetrates the skin. It forms small entry wound around the main entry wound, that is known as tattooing. So tattooing is because of what? Gunpowder. GP. Gunpowder that forms the tattooing. When you see gunpowder tattooing, it must be near shot. Near shot. So everyone write this in the chat box. Tattooing is equal to near shot. Write this in the chat box. Keep writing, guys. Tattooing, they are superficial entry wound around the main entry wound because of the penetration of the gunpowder. When you see this tattooing, it is a feature of near shot. Tattooing is equal to near shot. Very good. So Deepika Das, excellent. Everyone is answering. Jojo, very good. So very good point. Good. So abrasion collar, grease collar, blackening, and tattooing is done. Now next point, singeing of hair. Singeing of hair is because of burn injury. Burn. When you see singeing, that must be entry wound. In exit wound, there won't be any singeing of the hair. Okay? Burn. Inverted margin. Very simple funda. Inverted entry wound. Everted is your exit wound. But remember, there is an exception. Dum bullet. Dum bullet is a condition where in an entry wound you will see averted margin. This can be viva question. In which entry wound you will see averted margin? Your answer should be dum bullet. Very famous bullet discovered in Kolkata in a place known as Dum. So this is how you should answer. Yes. Then inner table beveling. When you see skull, when you see skull, no, in case of entry wound, inner table of the skull is more damaged. As you know, skull has two tables, inner table and outer table. In between there is a spongy bone. So when inner table is more damaged, entry wound. If outer table is more damaged, exit wound. Try to understand this. Skull has two tables, guys, inner table and outer table. If inner table is more damaged because it is unsupported in entry wound, then it is inner table beveling. In exit wound, outer table is unsupported, so it is more damaged. So ulta you need to write in the exit wound. Muzzle imprint. Sometime you will see, like this, contact entry wound, like this contact entry wound, So in contact entry wound, you will see imprint of the muzzle of the barrel. Muzzle, remember, muzzle. It is not the muzzle, biceps muzzle. This is the muzzle of the barrel of the gun. That imprint is seen. That is known as muzzle imprint. Then smaller diameter, bleeding is less. So there are 10 points you need to write in the exam. So theoretical points, guys. Theoretical points. So 10 points. Opposite is that is the exit wound. In exit wound, abrasion color absent, grease color absent, blackening absent, tattooing absent, singeing absent, everted margin, outer table beveling, muzzle imprint absent, larger diameter, bleeding is more. So this is how you should write the exit. Yes, guys, have understood this? Understood? Say yes or no, guys. Yes or no in the chat box. Come on, guys. 5 marks question, 3 marks question. Entry wound and exit wound. है ना? ठीक है? Yes, fine. Great. Now your turn to identify. There is a case of firearm injury. On examination, you can see entry wound. There is an entry wound is there. All of you say, what is the finding here? Look at this and tell me, what is the finding? What is the finding, guys? What is the finding? Deepika Das and Jojo. What is the finding here? Finding, if you see, so singeing of the hair. Very good. Singeing of the hair. Good point. Singeing is there. Blackening is there. Inverted margin. Less bleeding. All these are the features of entry wound. Good. Good. Now there are two images, guys. A and B. Identify which is entry wound, which is exit wound. Which is entry wound and which is exit wound. Chalo, chalo. Come on, guys, you need to interact with me in the class. A is entry wound, B is exit wound. Very good. A is entry, B is exit. Why exit? Because of the inner table, outer table beveling is there. Very good. Yes. Then, so the last topic of the day, what is the classification of mechanical injuries? What is the classification of mechanical injuries? It can be a 3 marks question. So forensic is like a mathematics. If you write proper answer, you get 3 out of 3. Okay, proper answer you should write. Mechanical injuries are those caused by mechanical force. Mechanical injuries either caused by blunt force trauma or sharp force trauma or the firearm injury. I know. So there are many examples, mechanical injuries. So some are caused by blunt force. Blunt force. Like example, blunt force trauma. Like example, stick is a blunt force weapon. Stick. Any weapon which is having blunt area. Stick, stone, stone. So all this causes blunt force injuries. What are blunt force injuries? Can I answer? What are blunt force injuries? Deepika Das and Jojo. What are blunt force injuries? So there are 3. What are they? Abrasion, contusion, and laceration. So abrasion, contusion, and laceration. Very, very important topic. Abrasion, contusion also known as bruise, and the laceration. Also the fractures. Yes, very good. So remember the funda. Abrasion is the most common mechanical injury. So abrasion is the most common mechanical injury. Contusion is also known as bruise. Bruise. Again, so what do you mean by contusion? What is the color changes in case of contusion? Can be 3 marks question. Medico-legal importance of contusion can be a 3 marks question. Spectacle hematoma, battle sign. So examples of contusion: black eye, black eye, battle sign, subcutaneous bruises, laceration, also known as tear. So the classification of laceration can be a 3 marks question. So what are the types of laceration? Anyone? What are the types of laceration? Types of laceration. So fractures also caused by blunt force. Fracture can be caused by blunt force also, sharp force also. But usually it is blunt force. Sharp force usually cause amputation of the limb. Yes. Okay. Yes. Laceration types. Anyone? Can you answer laceration type? Very very important question in your exam, forensic exam. Describe types of laceration. Medical legal importance. Scratch, no better. Scratch laceration is not there. You are right about avulsion, correct. Avulsion. Yes. So it can be avulsion laceration, tear laceration. You are right about tear. Split laceration. One more is that. Stretch laceration. So basically there are 4 types. Avulsion laceration, tear laceration, cut laceration. Some books it is given cut laceration, but cut laceration is not a correct term actually. Tear laceration fine, split laceration fine, stretch laceration. There are 4 types are there. So one very commonly asked question is split laceration. Split laceration. Okay. So after the class, you just go through this. Split laceration. This is very important. 3 marks question. It is also known as inside looking laceration. It commonly occurs at the bony prominences. It looks like an inside wound. The common area of bony prominences, like example scalp, skull. Okay. So avulsion laceration characterized by avulsion, amputation, flaying, deglowing. Tear laceration, tear of the skin, subcutaneous tissue. Split laceration we discussed. Stretch because of the excessive stretching of the limb or the skin that leads to laceration. Break in the continuity of the epithelium. Okay, so yes, fine. So then comes is your sharp force injuries. So what are sharp force injuries? Anybody can answer this, guys? Sharp force injury. Knife, dagger. So all is a sharp force. Kitchen knife, dagger. I know. Sickle. Hmm? What are these sharp force injuries? Jojo and Deepika Das. Sharp force injuries. Sharp force injury. So remember, sharp force injury, you will see clean cut margin. So laceration, you will see irregular margin. But in sharp force injury, there are margins are clean cut. Clean cut. So what are they? Incised wound, chop wound, stab wound. Very, very good. Incised wound, stab wound, and the chop wound. Good. Incise, chop wound, and stab injury. Incised wound, it has a dimension: length, breadth, and also depth. Length is a maximum dimension. Stab injury, the depth is a maximum dimension. Like example, stab injury over abdomen. So depth is the highest dimension in stab injury. Again, types of stab wound. Okay, types of stab wound. Anybody? What are the types of stab wound? This is not related to the question, but anyway, What are the types of stab wound? Anyone? Type of stab wound? Anybody? Anyone? Come on, guys. Come on. Penetrating. Very good. Penetrating wound. Penetrating. Perforating. Perforating. Some books gives punctured wound also. Punctured wound. Okay, penetrating, perforating, and punctured. Three piece. Three piece. So types of stab wound. What are differences between stab wound and incised wound, or incised wound and laceration? Can be a 3 marks question. Okay. Yes, pen beta. Yes, your pen also can lead to sharp force injury like stab wound. It can lead to stab wound. So because the tip of the pen, so that is sharp, so it can penetrate the skin. So it is considered as sharp force. Okay. Yes. Next, firearm injuries. Firearm injuries. So we discussed already entry wound and all. Bomb blast injury, ballistic injury also comes under firearm only. So what is the classification of mechanical injury? Your answer should be like this: blunt force injuries, sharp force injuries, and firearm injuries. So this is how you should answer. This is how you should answer, guys. All of you understood? Say yes or no. Come on, guys. Say yes or no. Have you understood the answer? This is how you should read and write in exam. So Farre series basically to tell you what to write and what not to write. So this is what you need to write for 3 marks. Say yes or no, Deepika Das, Jojo and others. Come on, guys. Come on, come on. Your energy should be very high during forensic class. Okay. Yes. Chalo. Now last question is there for you from thermal injury. Very commonly asked question. Explain rule of 9. Rule of 9. Anybody? What is rule of 9? 3 marks question. Rule of 9. So it is comes under thermal injury, anti-mortem or burn injuries. It is also known as Wallace rule. What is the rule of 9? Yes, one word answer, guys. One word answer, rule of 9. Rule of 9, it is the simplest rule that is to explain the surface area involved in burn injuries. Burn injury can be suicidal burn injury, accidental burn injury, or homicidal burn injury, like in case of dowry death. Dowry death can be 3 marks question, 5 marks question, 80 BNS. So, rule of 9, yes, extend a burn injury in an individual. Very good. So, and try to memorize this fact, guys. It was first explained by Dr. A.B. Wallace. This can be Viva question. Who discovered rule of 9? Dr. A.B. Wallace in 1951. Long back, 70 years back. A Scottish surgeon. He was a surgeon. He was practicing in Edinburgh, Bangor General Hospital. So it is also known as Wallace rule of 9. Wallace rule of 9. There are other rules also. So in surgery, you will get minimum 5 or 6 types of rules. This is the commonest one and very simple one to calculate. So surface area burn injuries. Other rules are there. So Browder rule is also there. Browder rule in case of children. Okay, children. Palmer rule is there. Palmer rule. So 1 palm is equal to 1%. It's a very simple method in case of scattered burn. In case of scattered burn, we use Palmer rule. Okay. Yes. Now come back to the question. Now explain the rule of 9. So this is your rule of 9. So in exam, you need to write a diagram like this, and you need to show rule of 9. Okay, this is a diagram you need to write in the exam. Head and neck area. Head and neck area. What is the percentage of burn? Head and neck area 9%. So front is 4.5, back is 4.5. Upper limb 9%. The front is 4.5, back is 4.5. Anybody, one lower limb, how much is the surface area? One lower limb. Yes, come on guys. One lower limb, front and back, how much is the percentage? Come on guys, come on, come on. Lower limb one full lower limb is involved. Say example, right lower limb is completely involved. How much is the percentage? Is it 9? 18. Very good. 18. One lower limb is equal to 18. Chest is equal to 18. Abdomen is equal to 18. Front is 9. Back is 9. So entire chest is 18. Entire abdomen is 18. Pudendal area 1%. So total it is 100. 100%. So depending upon rule, 9 rule. So you can see the diagram also. The front of upper limb 4.5. Front of lower limb 9%. So don't do mistake in this. Okay, pudendal area 1%. 1%. So this is the rule of 9. Very, very commonly asked question. So let me ask you one more question, guys. What is the most important sign, most important finding in ante-mortem bone injury? Anybody? What is the most important finding in ante-mortem bone injury? Viva question. So during post-mortem examination, some finding will suggest that it was ante-mortem injury. That means the person was alive at the time of bone injury. Yes, come on guys, bone injury, inhalation of soot particle, inhalation, hypoxia, hypercapnia, carbon monoxide poisoning and death, or hypovolemic shock and death. When person is alive, what would be the most important finding? Yes, Deepika Das, very good. Presence of soot particle. So when you see soot particle over the trachea, over the lungs, it is suggestive of ante-mortem bone injury. So this is very important finding. Say example, this is the lung. So this is the lung, guys, lung. So when you see soot particle like this, so you see soot particle like this. When you see soot particle, it's suggestive of ante-mortem bone injury. Okay? Yes. Yes, Deepika Das, your knowledge in forensic medicine is very, very good. Keep it up. Keep it up. So keep it up, guys. Yes. Then the comes is the MCQ now. Some MCQ, guys, at the end. True about heat hematoma. Let's see who is going to answer this. In some universities, they give 10 MCQs. 10 simple MCQ in your theory exam. Like in RGHS Karnataka, they'll give you 10 MCQ. Other universities also they give MCQs. Some simple MCQ I'm asking you. True about heat hematoma. So because of heat, there is a hematoma. So anybody, what would be the answer? Yes, guys, come on. So heat hematoma, it looks like your extradural hematoma. It is inside the brain. Wrong. No. It is between skull and dura mater. So this is the correct answer. B is the answer. It looks like EDH. Extradural hematoma. B is correct answer. Between skull and pericardium, no. Scalp and pericardium, no. It is basically above the dura mater. It is known as extradural hematoma, like heat hematoma, which is bilateral. So when you see, hematoma, it looks like honeycomb appearance. You will see bubbles. Honeycomb appearance. Honeycomb appearance is the appearance on gross examination of heat hematoma. Yes. Okay. Yes. Next. True about pugilistic attitude. Okay, this is very important question, guys. Pugilistic attitude, boxing attitude in case of burn injury. Anybody? What is that? Does it indicate anti-mortem burn injury or post-mortem burn injury, or cannot differentiate between anti-mortem and post-mortem? Indicate defense by victim. Anybody can answer? Pugilistic attitude, boxing attitude, because of heat stiffening. Heat stiffening, guys. So, anybody? Yes, pugilistic attitude, it is because of the coagulation of muscle protein. So, hands are flexed, elbow is flexed, okay, and arm is abducted like this, okay. So, this pugilistic attitude, remember, it can happen in anti-mortem finding, also post-mortem finding, okay. So, it cannot differentiate between anti-mortem and post-mortem, okay. Though pugilistic attitude is a very very glamorous finding in forensic medicine, but it has no medico-legal importance. It is not suggestive of whether it is anti-mortem or post-mortem. Okay, C is the answer, guys. C is the answer. Joel burn. Joel burn is seen in blast injury, electrocution, firearm wounds, lightning stroke. So in lightning, I remember we see filigree burn. Okay, filigree burn. So it is not the answer. In firearm, you will see singeing of the hair, not the jewel burn. Blast injury, we see primary, secondary, tertiary, quaternary blast injuries. No, answer is electrocution. In electrocution, you will see joule burn, also known as endogenous burn. Endogenous burn. Okay. So like this it is seen. So endogenous burn. So blackish endogenous burn at the entry of electric current. So when electric current enters the body through the skin is a very important insulator. So insulator, it is a it provides resistance against the electric current. So there will be formation of joule burn. Okay. Appearance of, okay, beta, okay, very good question. Sit up and beg attitude. Sit up and beg attitude is 100%. It is because of the heat coagulation. That is a post-mortem finding. Sit up and beg attitude. Okay, but this pugilistic can be anti-mortem as well. Okay, so we cannot differentiate between the both. So in clinical examination, appearance of bone hematoma, honeycomb, dish shape, stellate shape, smooth and rubbery. Smooth and rubbery. Heat hematoma. So heat hematoma, say example, this is the skull. So this is the skull. So you will see the dura mater. Say example, this is the dura mater. This is the dura. So you will see like this, you will see. So it looks like honeycomb like. Okay, honeycomb appearance. It is usually bilateral. Okay, again it is a post-mortem artifact. It cannot differentiate between ante-mortem and post-mortem finding. Okay, yes. Paradoxical undressing is seen in, last question of Farre series of this session. Severe hypothermia, transvestism, sexual perversion. So common in males, wearing female cloth, behaving like a female. Transvestism. Immersion syndrome, that is a example for drowning. So what would be the answer, guys? Paradoxical undressing, that is undressing in cold condition. in extreme cold condition. Okay, extreme cold condition. Because of the cold, so there will be damage to hypothalamus. Hypothalamus. When there is extreme cold is there. So what happens? It affects your higher centers in the brain, hypothalamus, anterohypothalamus, posterior-hypothalamus, anterohypothalamus that regulates heat, posterior-hypothalamus that regulates cold. So when your hypothalamus is damaged, then what happens? There will be different perception. So the person feel hot or very high heat even in cold condition. So this is actually severe hypothermia. B is the answer. P is the answer, guys. So in severe hypothermia, because of the involvement of higher centers in the brain, especially hypothalamus, so the person feels hot. He might remove his dresses. That affects some more, body homeostasis. So there will be death of the person. So paradoxical undressing, and one more is there, hide and die syndrome. Hide and die. Hide and die. So hide and die syndrome. Hide and die. So in a postmortem examination or crime scene examination, you will see dead body in a bed, around, so below the bed or in a wardrobe, some closed spaces, okay, unusual places you will see dead body. So probably because of the hallucinations, because of the hallucination that occur during very extreme cold temperature, so the person dead body might found in a closed spaces like wardrobe and all. So that is known as hide and die syndrome. Sometimes it resembles like a case of sexual assault as well. So undressing, hide and die, and a female probably more in favor of sexual assault and death. Okay, so this is about the paradoxical undressing. Yes, guys, have you understood? Yes, understood. Come on, come on. Yes, come on, guys. Yes, this will complete your session 2. Thank you all. If you have any doubt, you can ask me. So, was it helpful? Am I very fast or very slow or very boring, guys? Give me the feedback in the chat box. So, what we completed today, I'll just summarize today what are the topics completed. So, we started with grievous hurt, 5 marks question. So, grievous hurt is very important. So, we discussed 8 clauses. After that, we discussed about abrasion and types, medico-legal importance. Very important question. Then we discussed about some image-based questions. Then very important topic, features of entry wound. Features of entry wound we discussed with a nice diagram and pictures. Then we discussed about heat hematoma and all, rule of 9. So, okay, and classification of mechanical injuries. Some around 10 important Farre questions, so that can come in your university exam. So yes, okay, Deepika Das, okay, it was very nice, thank you. So for more explanation, more this type of video, you can go to that PW Med app. You can watch all the videos. All the videos are covered beautifully with the images and all. So that will be very helpful for your upcoming exam. Yes. Okay, Jojo, fine. Thanks for your feedback. Thanks for your amazing feedback. Amazing, I'm telling you. So it was my first class and it was amazing. Thank you. Yes, that's it about the today's lecture. So we are coming up with some more important Farre questions in next week, especially thanatology, toxicology, sexual offenses, and also practical forensic medicine. So that there are some sessions also. You can watch those videos and live classes. You can interact with me. The best part of our live classes is interaction. You can interact with the faculty. Okay. Yes. Thank you all.